Hello everyone, welcome to the refresher training for the pain study. This training is approximately 25 minutes long and will cover the essential information that you need to know to enroll a patient in the study, as well as all of the post-enrollment steps. If you'd like a more in-depth training on the study, you can look in Vector, where a recording of the full training is available, where we go into detail on all aspects of the study. So a little bit of background info here. The pain study is seeking to compare ketamine and fentanyl for pre-hospital pain management of traumatic injuries. It's organized by the LIGHTS Network, which is the pre-hospital research division of the University of Pittsburgh, and it's funded by the United States Department of Defense. Pain is one of a bunch of studies that's run by the LIGHTS Network, and the LIGHTS Network is a team of about 50 trauma centers, 100 EMS systems, and over 4,000 paramedics nationwide who come together to collaborate on different research studies. And Vermont is one of 14 sites that's going to be participating in the pain study. So the pain study medication will come in a brown plastic wrapper and will contain 2 syringes. And I'll show you a picture of what that study medication looks like in a moment. So this study is comparing ketamine and fentanyl for pain. However, the study medication cannot be used in every situation where you would normally give fentanyl or a pain dose of ketamine. In order to be eligible for the study, the patient has to meet certain criteria. And there are what we call inclusion criteria and exclusion criteria. And in order for a patient to be eligible for the study, they have to meet all of the inclusion criteria and none of the exclusion criteria. So we're going to go through each of these criteria one by one on the next few slides. There are 3 inclusion criteria for pain. So first, the patient has to be in pain. So the patient has to have a pain scale of 5 out of 10 or greater on the NRS, which is the numerical rating scale, or our normal 0 to 10 scale, or 2 or greater on the CPOT scale, which is a pain scale used to assess pain in nonverbal patients. If you're familiar with the CPOT, feel free to use it, but otherwise don't bother learning it just for this study. For most, if not all providers, will be basing eligibility based on that NRS 0 to 10 scale. Second, the patient has to be being transported to the University of Vermont Medical Center Emergency Department after a traumatic injury. So they have to have a traumatic mechanism to their pain. And finally, the patient has to be in compensated shock, which for this study, that's defined as a heart rate of 115 or greater, or a shock index of 0.9 or greater. And shock index is calculated by taking the heart rate and dividing it by the systolic blood pressure. If you came to our trainings in May, you might remember that there used to be only the shock index. There wasn't that heart rate criteria. They found that people were making so many math errors and enrolling people who weren't eligible trying to calculate that shock index that the study was at risk of being paused by the FDA because people were being enrolled who shouldn't have been. So they found that the heart rate was a pretty good indicator of meeting shock index as well. So they added that criteria as an option. So if a patient has a heart rate of 115 or greater, they meet that compensated shock inclusion criterion. If their heart rate is less than 115, you will need to do some math to see if they meet that shock index. And we know math is hard, especially when you're busy caring for a patient. So there will be calculators with every drug kit. We're going to talk through that shock index calculation on the next slide. There's some other resources available as well. So if a patient meets all 3 of those criteria, they could be eligible for the study. It's important to note that they can meet those criteria for shock index or heart rate at any time during that patient's EMS care, including first response vital signs, as long as you trust those vital signs and you document them. So if you have a patient who you first take vital signs and they have a heart rate of 120, and then once you get an IV and you're ready to give the study drug, their heart rate has dropped to 110, as long as you trust that first set of vital signs that you obtained, and as long as you document those vital signs, that patient would still be eligible for the study, assuming they meet all of the other inclusion-exclusion criteria. Even if all 3 of those inclusion criteria are met, the patient still might be ineligible based on the exclusion criteria. So if any of the following are true, the patient should be excluded and should not be enrolled in the study. So if the patient doesn't have IV access, they are not eligible for the study. So the study drug has to be given IV. It can't be given IO, can't be given IM, it can't be given intranasally, has to be given IV. If the patient is a pediatric, so under 18 years old, they cannot be enrolled in the study. If you have a potentially pregnant patient, so for this study that's defined as females less than 50 years old, the FDA has said that ketamine has an unknown pregnancy class because it's never been researched, and they said that due to that, we could not enroll any person who could potentially be pregnant. And Lights pushed back on that very hard because women are already very underrepresented in trauma research, and limitations like this will only exacerbate that issue, but the FDA wouldn't budge. And they said if we wanted to enroll females less than 50, we would have to do a urine pregnancy test in the back of the ambulance, which is obviously not feasible. So if you have a female patient who is less than 50 years old, do not enroll them in the study. If you have a prisoner, so oftentimes for research, oftentimes in EMS, prisoner can be a little bit hard to define. So in this case, if you have somebody who is in handcuffs or in police custody at the moment, do not enroll them. If you have a patient who maybe was drinking and crashed their car and you think they'll be in trouble with the police down the line, but they're not currently in police custody, they're not currently in handcuffs, you can enroll that patient. But if there's, if they're being transferred from jail, if they're currently handcuffed, currently in police custody, or there's any question about it and you're not sure, just don't enroll them in the study. If you have a severely hypertensive patient, so for this case, that's defined as systolic blood pressure greater than 180, do not enroll them in the study. If they have a known allergy to either fentanyl or ketamine, or if there's any contraindication based on our local protocol. So if you wouldn't feel comfortable giving your patient fentanyl or ketamine, don't enroll them in the study. So if you have a patient with severe hypotension and you wouldn't normally consider fentanyl as an option because of that, don't enroll them in pain. If you have a patient with a history of schizophrenia and you otherwise wouldn't want to give them ketamine, don't enroll them in pain. If they have an advanced airway prior to the first dose, do not enroll them in the study. And finally, if there's any objection to the study or to the study drug, or if the patient is wearing one of these opt-out bracelets that look like this, that were given out during the community consultation phase of the study, don't enroll them. We gave about 28 of those bracelets out. None of them were in Chittenden County, so it's very unlikely that you will encounter them, but it's very important that you know that these exist because we always want to make sure we're honoring our patient's wishes. So if you have a patient who you think might be a good candidate for the pain study, but they have a heart rate that is less than 115, you will need to do a little bit of math to calculate their shock index. So we'll go through some practice for that on the next slide. So for patient 1, they have a heart rate of 125, a BP of 112/74. So they have a heart rate of 125, so we can just stop right there. Their heart rate is equal to or greater than 115, so we don't need to calculate the shock index. That patient is eligible for the study, assuming they meet all other inclusion and exclusion criteria. But just for the sake of practice, to calculate that shock index, we would take 125 divided by the systolic blood pressure, 112, which would get us a shock index of 1.11, which is greater than 0.9, so they would also meet the shock index. Patient 2 has a heart rate of 80, BP 109/59. We'll take 80 divided by 109, get us a shock index of 0.73. That patient would not be eligible for the study because that shock index is less than 0.9. Patient 3 has a heart rate of 101, BP 115/70. We'll take 101 divided by 115, and that'll get us a shock index of 0.88. This patient actually would be eligible for the study because we're able to round up from 0.85 to 0.9. So you're able to round to that first decimal place up to 0.9. So 0.85 or greater is eligible for the pain study, meeting the shock index, assuming they meet all other inclusion/exclusion criteria. So we know no one likes to do math in the back of an ambulance, so there's a bunch of different tools to help make verifying that inclusion criteria simpler. So first, like we just talked about, if the heart rate is greater than 115 at any point during their care, you don't need to do math. They're eligible, assuming they meet other exclusion/inclusion criteria. If the heart rate is less than 115, then you will need to make sure they meet the shock index. And to do that, first you're going to look to see if their heart rate is greater than their systolic blood pressure from the same set of vital signs. If it is, they meet the shock index. If it's not, they still might meet the shock index, so you'll need to do a little bit of math. For that math, there are 2 additional resources. There's a reference chart that you can look at quickly to see if the patient is in the green. However, it's not perfect because they're only listed in intervals of 5 or 10. So the drug kits will also include a calculator that will have the shock index formula written on it. And that shock index chart, we have different versions that can go in your pocket. There'll be one in the drug kit, and we have some that can go in your ambulance if you would like that as well. And here we just have a short video from Lights talking about that shock index.
A shock index is calculated by dividing the heart rate by the systolic blood pressure from the same set of vital signs. Traumatically injured male patients ages 18 years and older and female patients ages 50 years and older who have a shock index of 0.9 or greater, along with a pain score of 5 or greater, that are being transported to our participating trauma center may be eligible for enrollment in the Lights Network Pain Study.
And here we have one additional flow sheet that will be available to you to help guide you through the enrollment process. And this guide really sums up the most important aspects of this training. We know that when you have a sick trauma patient, you have a lot of things to do, and remembering all the inclusion and exclusion criteria and steps of enrollment can be difficult. And mistakes are always going to be possible. We really want to do everything we possibly can to ensure that we only enroll patients who are eligible for the study. Our goal is to have the lowest number of ineligible enrollments of all 14 sites so that we can be included in more Lights Network studies in the future that would allow us to get whole blood on the ambulance and other really interesting interventions that we would love to bring to Vermont EMS if this study goes well. So thank you for your help in learning this protocol. We have a lot of different posters available for the shock index and the inclusion and exclusion criteria. We have pocket cards with that information. There will be detailed information with the study drug kits. We're really trying to do everything possible to make verifying the eligibility criteria and completing the enrollment steps as easy as possible. We know it's a lot of steps, and you are going to have a lot going on when you have these patients. If there are any other resources that you think would be beneficial, please don't hesitate to reach out to us. We are more than happy to help in any way we can. And the whole research team, all of the District 3 medical directors, Dr. Wolfson, who's leading the study for Vermont, we are all extremely thankful for your support in making this study happen and having it be a success. And we really could not do it without you. So if there's anything we can do to further support your involvement in the study, please don't hesitate to let us know. This is the wrapper that the study drug will come in. Its label contains the kit number, the expiration date, as well as a QR code that you will scan to log the patient enrollment in the research system. This is what notifies the research team that a patient has been enrolled, so we know to go approach that patient and consent them for continuing participation. The wrapper also contains unblinding information that the hospital can use to reveal what medication was given if the patient has an allergic reaction or if there is any other need to know what was given for that patient's care. If a patient has an allergic reaction to the study drug during your care, treat the allergic reaction like you would any other allergic reaction, and then make sure the hospital care team is aware that the patient had an allergic reaction that you think is related to the study drug, and they will contact the number on the drug wrapper to unblind the study drug. The pain study drug is formulated to deliver the correct amount of fentanyl or ketamine based on the patient's weight, in line with our current Vermont EMS protocols. So the study drug dose is 0.1 milliliters per kilogram, up to a max of 10 mLs. So if it's ketamine, the study drug is concentrated at 2.5 milligrams per milliliter of ketamine, which means the patient will be getting 0.25 milligrams per kilogram. If it's fentanyl, it's concentrated to deliver 10 micrograms per milliliter, which will deliver 1 microgram per kilogram of fentanyl. So for example, if we have a 70 kilogram patient, we will be giving 7 mLs, which will deliver 70 micrograms of fentanyl or 17.5 milligrams of ketamine. It's also important to note that the study drug comes in 20 ml syringes. The FDA states that syringes cannot be filled completely with pre-filled compounded drugs, so it will be given in a 20 ml syringe, but it will only be filled to 10. So once you confirm all the inclusion, exclusion criteria, you're certain that the patient meets those criteria, you've double checked yourself, then you can open that drug kit, and then you're going to give 0.1 mLs per kilogram or 1 ml per 10 kilograms via slow IV push over 2 minutes, and then a slow flush as well. Then you're going to wait 15 minutes. If the patient's pain is still 5 out of 10 or greater, give a second dose from the second syringe. If after 10 minutes, your patient is just seething in pain, you think they need more pain medication, you can stop the pain study enrollment and you can give normal narcotics as a rescue medication. If that happens, you'll need to document that. You'll need to explain that in the QR code, and you also will need to make sure that you do not continue giving the patient the second dose of pain study. Once you've transitioned off the pain study dose and giving narcotics from our normal paramedic box, then you can't give more pain study dose. But your clinical care, your judgment always comes first. And if you think that them continuing in the study is not in their best interest, then you don't need to wait that full 15 minutes. You can use the normal narcotics as a rescue medication. But ideally, we will give pain study drug if they need an additional dose at that 15-minute mark if their pain is 5 out of 10 or greater. When you get to the hospital, you're going to give a handoff report. It's going to be a pretty normal, standard handoff report. We just ask that you really emphasize the pain scores that you obtained, the initial pain score after the first dose, before the second dose after if you gave that second dose, and then after the second dose, and then the current pain score at arrival at the hospital. The hospital team will be familiar with the pain study, and they will know what you're talking about when you say you've given them either ketamine or fentanyl. Just making sure that you emphasize that you enrolled them in the pain study, they will know what that means. And then once you get to the hospital, you give your handoff report. The first step is to take that brown wrapper and to scan that QR code. That will bring you to a form that looks like this. And filling out this form is very important because this is what notifies the study team that there's been an enrollment and that we know to go talk with them and obtain their consent for further participation in the study and let them know about the care that they received. So we don't need any PHI in this survey. We just want a very rough description so we can easily find the patient. Something like 60-year-old female, femur fracture would be perfectly adequate, just so we can track them down and be notified that there was an enrollment. Once you click submit, we ask that you close the tab and don't continue to click submit. If you don't close the tab or if you keep hitting register, it keeps populating patients and just sending emails constantly to the study team. One other important note is that the patient is considered enrolled once the kit is opened with the intent to give it to the patient. So if the kit gets opened accidentally, if it gets caught on something or ripped open, but you weren't intending to give it to the patient, that's fine. Don't scan that QR code. Just document the situation on the narcotics log and drop the whole kit in the pharmacy drop box where we return the paramedic boxes. However, if you run through the criteria, if you think the patient meets the enrollment criteria, then you open the kit and you're about to give it, and you realize you did the shock index calculation incorrectly, or you realize that the patient actually isn't eligible for the study. If you've already opened the kit, you need to scan the QR code to enroll that patient. Don't give the medication if you realize after opening that the patient actually isn't eligible, but once you open that kit, you have to scan the QR code. Likewise, if you realize after you've given the first dose that the patient isn't eligible, don't give the second dose. We really want to make sure all of our inclusion and exclusion criteria are met before opening the drug wrapper. But if you do make a mistake, the earlier you catch it, the better. So bottom line, if the kit is open with the intent to give it to a patient, even if you later learn that they're not eligible, you have to scan that QR code and enroll the patient and then explain the situation on the narcotics log, waste that drug, and place the enrollment information in the pain box. So once you've scanned that QR code and filled out that online form, the next step is to waste your medication. So unless you gave 10 ml from both syringes, you will need to waste the medication. Even if you opened one syringe and gave all of it and have an unopened syringe, you're going to waste that as well. So we're going to waste it in the Caxis as usual. The pharmacy pain study narcotics log will show on the next slide. It's very similar to our current paramedic box narcotics form. So you'll need either 2 paramedics or a paramedic and a nurse to waste it. This is what that form looks like. It mirrors our normal paramedic box log very closely. One key difference is we don't ask you to log daily vault checks on the back of the pain study log. That would mean filling out that log twice. We don't ask you to do that. We do ask that you, however, fill out that log if the pain study moves from one apparatus to another. So if you're taking it out of service or for some reason it gets moved, we ask that you log that movement on the back, as well as scanning that QR code and refilling out where that study drug is, so that we can know at any point where a specific kit number is. So this is the pain study drop box. So once you've scanned that QR code, once you've wasted your medication and completed the narcotics log, you're going to take the brown drug wrapper and you're going to take the narcotics log and you're going to place it in this box. So this box has some instructions on it if you need some guidance for what to do, but that's what that box is there for. It receives both the brown drug wrapper and the narcotics log. And again, these are controlled substances. Please treat them as such. The process is designed to mirror our current paramedic boxes as closely as possible, but there are a few slight differences. So the biggest difference is when you remove drug from the Pyxis, we need you to scan a QR code on the Pyxis or on the back of that narcotics log. Whenever you're removing that drug, we need you to scan that QR code. And the reason for that is the FDA or the DEA will sometimes audit the study drugs, and we need to know where a specific kit number is. So we know it's a lot of QR codes. We know it's kind of annoying, but please take the time to scan that QR code when you first get the drug and if you're moving it from one apparatus to another. Once you've returned the drug wrapper, the narcotics log into that pain drop box, once you've removed new study drug and filled out that QR code, then we ask that you complete the chart for the patient within 12 hours. This is to help ensure that the chart is pulled appropriately into Epic without issue, because that is how the study team obtains the patient data to then fill out the required information we need as part of this research study. In Siren, there is a pain study option in the pain medication dropdown. This is what it looks like. It's just called pain study drug. Just fill it out as you normally would with any other medication. So this is just a recap of all of those steps. So once you get to the hospital, you're going to give the handoff report to the care team. Then you're going to take that brown wrapper. You're going to scan the QR code on the brown wrapper. Then you're going to you're going to fill out that form and submit it. Then you're going to go to the AC med room and you're going to waste your remaining medication. You're going to fill that out on the pharmacy narcotics sheet. Then you're going to take that study drug wrapper and the narcotics form and put it in the pain drop box, which is just above the cactus and has some instructions on it. Then you're going to remove the new study drug from the Pyxis and scan the QR code tracking code. And then finally, fill out that documentation in your Siren report within 12 hours. So for most research studies, consent happens prior to the intervention, after a long discussion of risks and benefits and the patient having time to decide if they want to participate. But as you're all probably well aware, there's really not time for that whole process in the back of an ambulance with a trauma patient in severe pain. So normally, research wouldn't be possible, but there is a mechanism for doing this type of research, and this is called the exception from informed consent, or EFIC process. So we talked about this in the full training, but just a quick review to make sure you know kind of the background information, the background work that we've done to help make the population aware of this study and ensure it's something that people support. Throughout the last 10 months or so, we've conducted a bunch of community outreach. So we've been to a bunch of different in-person events. We've purchased over 500,000 advertising impressions. There have been a bunch of news articles. And we've, as part of our community consultation, we've collected almost 700 survey responses. And to the question of should this study be done in the community, about 90% surveyed answered yes. So there's pretty broad support for this within the community. And there's also a lot of eyes on it to make sure that this research is supported and is being done in an ethical way. So on that note, we want to be very transparent with our patients about what's happening, but we also want to be mindful that EMS providers have a lot going on when you're dealing with a trauma patient. So when you're enrolling a patient in the study, you are not expected to explain the details of the study to them. Like any time we give a medication, we want to tell our patient what we're giving. In this case, you'll say something like, we're going to give you some pain medication. It's going to either be ketamine or fentanyl. Are you allergic to either of those medications? Most patients aren't going to care what they get. They're just going to be glad to have some pain relief. If they ask, what do you mean it will be either ketamine or fentanyl? Why don't you know? Or something along those lines. If they have any apprehension, then we have this short script that will come with the drug kit that can help guide you in shortly explaining the study to the patient. We're not trying to hide anything from our patients, and we always want to ensure that we're honoring their wishes. EFIC is a rigorous process that is tightly regulated and is intended to advance medical knowledge through research that otherwise wouldn't be possible to do. But the foundation of ethical research is that we always want to be acting in the patient's best interest. So if you think a patient has an objection to the study, or that giving the study medication is not in their best interest to do so, don't enroll them. Your clinical judgment, your clinical care always comes first, and you are never under an obligation to enroll a patient in this study. Some other considerations: if you anticipate handing off your patient, it's likely best to not enroll them in pain. So if you are a medic trained in pain and you're going to be transferring care to another EMS service, you cannot hand off the pain study drug to them, even if they've been enrolled in the study. However, that drug wrapper has to stay with the patient because that has the unblinding information in it. So if you enroll somebody in the study, you realize you're not going to be transporting, it's likely best to either continue the care of that patient and go up to the hospital with them, or you're going to need to hold on to the study drug, take the picture of that brown wrapper so you can scan the QR code, give the wrapper to the accepting care team, and then you're going to need to travel to the hospital to waste that medication, just like you would if you opened a paramedic box, gave some narcotics, and weren't going up to the hospital with that patient. You would still need to go to the hospital to waste that. If you are an accepting medic, you can receive a patient who's been enrolled in pain, but you cannot continue to give them study medication, even if you're enrolled in the study. So you can't accept pain study medication from another medic, and you definitely can't open another kit to give to that patient. So bring that brown drug wrapper with them, but don't give them additional pain study medication. Intercepts are totally fine. If anytime you're going to be continuing the care of that patient, completely fine to enroll in the study. But just for logistical reasons, if you're going to be handing off a patient, it's likely best to not enroll them in that study. We also created this reference material in the style of our normal Vermont EMS protocols that will be included in the drug kits and will also hopefully be posted in the AC Medroom. This kind of goes into some of the details on and nuances, including the inclusion and exclusion, as well as the use of non-study drug pain medications before and after pain drug. So feel free to reference this. We'll try to make it as available as possible. This has some kind of more details laid out. Thank you for taking the time to watch this presentation and learn about this pain study. If you have any questions at all, please don't hesitate to reach out to one of the members of the study team. My email is listed right here. And as a small thank you and a reminder to enroll your patients in the pain study, we have X shears available. If you did not receive any shears yet or need some for your apparatus, feel free to reach out. We also have funding available for training resources. If you need a new IV arm or any trauma-related training resource that could help your service, just let me know at the email on the screen. And we are always more than happy to come to your service to conduct any in-person training or answer any questions. So please just let us know if that would be helpful. Thank you for watching this training. If you'd be able to scan this QR code to track your attendance, that would be greatly appreciated. It's a lot simpler than annoying your training officer asking for a bunch of vector certificates. Thank you for taking the time to learn about the study and helping to ensure the study execution goes smoothly and that our Vermont EMS system can continue to help advance EMS care as part of these large multi-center studies. Thank you for your time. Appreciate it.